and thank you for the opportunity to discuss how leaders can prioritize workforce well-being in healthcare. The objectives of today will be to describe the impact of burnout on the healthcare system, identify signs and contributors of employee stress and burnout, distinguish wellness and well-being, and finally, demonstrate the role of administrative leaders in supporting workforce well-being. Why do we need to address stress in the workplace? Well, according to the recent 2024 AMA report, burnout is slowly starting to downtrend for the first time since the pandemic. However, there is still a significant amount of burnout being reported in healthcare. Emergency medicine continues to report the highest rates of burnout and job stress. Female respondents also report higher rates of stress and burnout compared to their male peers. Respondents between years 5 and 20 years of practice also describe feeling less valued compared to their counterparts who have been in the workplace for under 5 years or greater than 20 years. In general, burnout is reported higher in healthcare compared to other U.S. workers. Research shows that drivers of burnout are more frequently related to systemic issues, while historically it was thought to be only related to individual factors of resilience. We see many drivers associated with burnout among healthcare workers. At the individual level, limited flexibility and autonomy of their practice, in addition to a culture that does not support collaboration and vulnerability, are found to be major contributors. At the organizational level, lack of leadership support, excessive workload and work hours, and barriers to seeking mental health support have been described as contributors. In the larger healthcare system, drivers of burnout include misaligned reimbursement policies, excessive administrative work, and poor care coordination. At the societal and cultural level, health misinformation, mental health stigma, and unrealistic expectations of healthcare workers also contribute. At the individual level, burnout and mental health diagnoses have serious implications for our clinicians, both personally and professionally. Clinicians experiencing burnout and mental health challenges have a ripple effect onto our patients. It leads to the inability to provide compassionate, safe, and quality care. Our healthcare systems are impacted when this leads to limited personal resources, a decrease in access to services, and subsequent increased costs of care. In the community, we can see this manifest with erosion of trust of the healthcare system and worsening population health outcomes. We need to address the outside factors that are significantly contributing to the moral distress, unreasonable expectations and demands placed on healthcare workers, and system inefficiencies that make it difficult to do the right thing for our patients. Stress is the physiologic or psychologic response to an internal or external trigger. It is necessary to have some stress in our daily life, and it is a normal reaction to everyday pressures. However, it can become unhealthy when it upsets day-to-day functioning. When stress becomes overwhelming, it can lead to burnout. Burnout is cumulative, and it is an occupational hazard. We see higher risk of burnout in high-stress environments. Burnout refers to physical, emotional, or mental exhaustion. It is accompanied by decreased motivation, lowered performance, and negative attitudes towards oneself and others. Burnout results from performing at a high level until stress and tension, especially from extreme and prolonged physical or mental exertion or an overburdening workload, take their toll. Signs of burnout include neglecting of one's self-care, irritability, and unexplained tension, isolation, inconsistent sleeping patterns, and feeling numb or apathetic about life.
Stressors in the workplace are multifactorial in nature. We will discuss several here on this slide, but this is not all-encompassing. Heavy workloads are affected by ineffective EHR systems, lack of adequate support staff and physician coverage, excessive administrative tasks, and more. Unpredictable schedules or lack of control over your schedule can be stressful, as well as limited autonomy within scheduling or at work can also contribute to workplace stress. A sense of lack of support or transparency from leadership contributes to workplace stress. Low wages or a mismatch between workload and compensation is another workplace stressor. Hostile or dangerous working conditions, This can include harassment or discrimination at work. And lastly, a toxic work culture. This is a work culture that can be disrespectful, non-inclusive, unethical, cutthroat, and/or abusive. Stress from the workplace can lead to numerous negative outcomes: a heightened fight or flight response, a disruption of sleep, acute illnesses and chronic health conditions such as higher rates of diabetes, heart disease, cancer, obesity, and more. There is also an increase in mental and behavioral health challenges such as depression, anxiety, suicidal ideation, substance misuse, etc. All of these can feed on each other as well, causing even worse outcomes. Combined stress from the workplace and personal demands increases the effect of the negative impacts mentioned on the previous slide. These also can have an impact on family, children, significant others, and other loved ones. Now that we know there are all these drivers to stress and burnout in the workplace, how can we improve workplace well-being and professional fulfillment in order to combat this? First, let's distinguish wellness and well-being. Wellness is an individual's choices that contribute to one's health, while well-being can be influenced by external factors, how the outside world impacts each element in a positive or negative way. We will distinguish these concepts by discussing the different scope, approach, measurement, and goals of each. In regard to wellness, it is more focused. There is an increased focus on physical health as well as initiatives to contribute to positive physical health, and there are proactive health measures that an individual takes. Well-being, on the other hand, is broader. It represents overall life satisfaction and happiness. The approach to wellness includes active life choices as well as exercise or healthy eating. On the other hand, one's approach to well-being includes an overall state of balance and contentment in various life domains. Wellness is measured through very specific health metrics, as well as evaluating one's fitness levels or dietary habits. Well-being, on the other hand, is much more subjective in measurement. There is self-reported happiness and overall life satisfaction. The goals of wellness including maintaining or improving health, as well as taking proactive measures to improve an individual's wellness. Well-being, on the other hand, the main goal is to achieve a balanced and fulfilling life. Our professional life is so intertwined with our identities, which is why it's important we focus on well-being from a job perspective. Wellness is not as comprehensive as well-being, which is also why we need to put effort into focusing on improving our well-being through integration of professional and personal lives, not just a work-life balance.
Another important concept to understand is professional fulfillment. It is a feeling of satisfaction and happiness that comes from finding a career that balances your interests and skills. It is a dimension that encompasses the organizational work environment, values, and behaviors that promote self-care, personal and professional growth, and compassion that people have for themselves, their colleagues, and beneficiaries of their work and innovations. In 2017, Stanford created their model of professional fulfillment. This model helped guide the work of well-being in healthcare to specifically call out the three major themes that contribute to professional fulfillment. These included culture of wellness, efficiency of practice, and personal resilience. Culture of wellness included elements related to purpose and meaning, sense of belonging or community, compassion, and leadership behaviors and practices. Efficiency of practice included elements related to systemic issues, policies, processes, ability to do one's job with ease and without barriers. Personal resilience includes items such as self-care, self-compassion, and work-life integration. Aligning key stakeholders from different professional types and leaders, especially from operations, clinical informatics, and mental and behavioral health, around this model can help inform future programs and initiatives that will have meaningful impact on reducing burnout and enhancing professional fulfillment. In 2025, this model was updated to be more broadly applicable to biomedical scientists and other healthcare workers, as well as those outside of healthcare. Professional fulfillment was replaced by occupational well-being to ensure that the model captured all employee experiences. However, this update does not represent a fundamental change in the well-being work or the importance of incorporating professional fulfillment. In preventing or limiting stress and burnout, our administrative leaders and the organizations need to be heavily involved. Systems must have accountability for this work, the ability to identify and address contributors to stress and burnout at all levels of the organization. They must have a way to measure engagement, well-being, and professional fulfillment of their employees. And finally, they need a process for continuous improvement based on the data and needs of the healthcare team.
The U.S. Surgeon General's framework for workplace mental health and well-being includes 5 key components. These include a protection from harm, connection and community, work-life harmony, mattering at work, and opportunity for growth. All of these components are important, but specifically for emergency medicine, there should be focus on protection from harm, both in regard to physical and psychological safety. Protection from harm includes these 4 variables: a prioritization of workplace physical and psychological safety. There are certain groups that are at higher risk for physical safety: those who work in environmentally facing jobs, racial and ethnically diverse groups, as well as women. The organization should hold themselves accountable to prioritize and improve physical and psychological safety when needed. Organizations should enable adequate rest. This means allowing for breaks and rest days, as well as an accessible utilization of vacation time and/or sick days. Organizations should normalize and support mental health, as well as operationalize inclusive norms, policies, and programs. Connection and community includes creating cultures of community and belonging, cultivating trusted relationships, as well as fostering collaboration and teamwork. There is an epidemic of loneliness in the United States. 50% of Americans describe feeling lonely or a sense of loneliness, and this is as physically devastating as smoking 15 cigarettes per day. Contributing to work-life harmony includes providing autonomy over how work is done, making schedules as flexible and predictable as possible, increased access to paid leave, as well as respecting boundaries between work and non-work time. Making employees feel like they matter at work is important as well. This includes providing a living wage, engaging workers in workplace decisions, building a culture of gratitude and recognition, as well as connecting individual work with the organizational mission. Opportunities for growth include offering quality training, education, and mentoring, fostering clear, equitable pathways for career advancement, and ensuring relevant and reciprocal feedback. Remember, optimal work-life integration and fulfillment is a journey, not a destination. Thank you for tuning in. Please reach out to Dr. Pilarski or myself, Dr. Khan, if you have any questions, concerns, or ideas about how you might want to improve well-being at your workplace.